Tonight,
things are moving along. Really a horrible situation that we've been confronted with, but they're moving along.
testing takes center stage as the push to reopen America becomes a top priority. The latest on the coronavirus crisis. Plus, how likely will the U.S. face a food shortage?
We have farmers upstate who can't sell their product.
Why millions of pounds of meat may disappear from the supply chain and what can be done to prevent it. And an updated look at some of the worst countries in the world for religious freedom. All this and more tonight on Faith Nation. U.S. coronavirus cases hit another unwanted milestone, crossing the 1 million mark. Welcome to Faith Nation. I'm John Jessup. With more than 57,000 killed in the COVID-19 outbreak here in America, tonight some good news out of the Big Easy. No new coronavirus deaths in New Orleans for the first time in over a month. This as more than a dozen states are now allowing some businesses to reopen. Meanwhile, Congress just put the brakes on its scheduled return here in Washington. CBN White House correspondent Ben Kennedy joins us now with more on how the president is responding tonight. Ben?
Well, John, President Trump is facing pressure to increase testing as health officials maintain it is a critical part to get back to business.
People are anxious to go back to work.
President Trump touted plans Tuesday to expand testing. His COVID-19 discussions with lawmakers will have to wait, though, after the House reversed course on bringing the chamber back next week.
I think they should be back. I think they should all come back, and we should work on this together.
The commander-in-chief praised Florida Governor Ron DeSantis, who flew into D.C. to brief the president on a plan to reopen the Sunshine State that he will announce publicly tomorrow.
I think that a lot of this is a confidence and building confidence with the public that the next step is going to be done thoughtfully, it's going to be done in a measured way, and it's going to be done with an eye to making sure that we're not pretending that this virus just doesn't exist. I mean, we have to make safety a priority.
Governors in states from Georgia to Colorado have already eased restrictions, some restaurants even resuming dine-in service.
I'm kind of excited because these are my family. I get emotional. But, you know, these guys need work. They need to make money.
Texas and Ohio plan to act in the coming days. Harder hit states like New York and Louisiana are moving slower and urging people to stay home.
Number of new cases, still 1,000 new COVID cases every day. Puts it in perspective.
In an airborne salute, the Blue Angels flew over the Big Apple Tuesday to honor healthcare workers, first responders, and frontline defenders battling the coronavirus outbreak.
The numbers are tough to comprehend, but they illustrate the lethal grip COVID-19 can have on seniors.
While next door, Governor Baker announced 3,000 deaths in his state, 56% coming from nursing homes. This as the cases of COVID-19 in the country surpassed 1 million.
Now, in an effort to stop the spread, Delaware is the latest state to require all residents to wear masks when out and about in public. JetBlue is also the first airline requiring not only employees but passengers wear masks. That begins early next month. President Trump was asked if all airlines should follow suit, and he said, you know what? That's a good idea. John?
Thanks, Ben. And with us now is ABC News medical contributor Dr. Darian Sutton, an attending emergency physician in New York City who has been on the front lines fighting the outbreak. Dr. Sutton, thank you for being with us. We know New York is the hardest hit city, the epicenter. Where do things stand now in the fight against the virus? Are you beginning to see things calm down as the confirmed number of cases drop?
So we're beginning to see things calm down from the emergency room perspective, but it's important to understand that many of the patients who are admitted to the hospitals, specifically those who are admitted to the ICU, have relatively long periods of length of stay, which can average around 2 to 3 weeks. So we still have almost at capacity ICUs in our hospitals.
Yesterday, the CDC added 6 new symptoms to the list of coronavirus traits. Does this signal that it's an unpredictable disease and how it displays in different patients?
Absolutely. I can attest to my experience with my patients. The symptoms are very variable. They're very, very unsimilar to similar outbreaks prior, such as the SARS outbreak in 2003, where 99 to 100% of those patients had fevers. What we're finding is that currently with the COVID-19 for example, only around 75 or 60 to 75% have an actual fever. The rest of the patients have body aches, shortness of breath, and this GI component, which is very abnormal for respiratory infections.
We know that more states are lifting their stay-at-home orders and they're starting to expire. Does this cause you any concern working on the front lines?
It causes concern because each state and each community has its own numbers. And so what I'm trying to say is that the testing that is available for certain places is more than others. And what we have to come to a consensus on is we need massive amounts of testing in order to be able to identify when hotspots develop so that we can attack them quickly and decrease the possibility of having a resurgence of the COVID-19 virus. I think it's appropriate that some states can release some restrictions, but I want to make sure that people understand we're stepping into our new normal. We're not going to go back to the immediate thing that we had right before this pandemic started. We have to still practice social distancing and shelter in place as best as we can in order to decrease the possibility of this virus coming back and hitting harder.
And new normal indeed. Dr. Sutton, last question for you. We know that the coronavirus is taking a toll. I'd like to get your response on how you and your colleagues are handling everything, given the fact that we just learned of the doctor, one of your New York colleagues, who committed suicide after surviving COVID-19, but then going back and treating patients with COVID-19.
Yeah, my heart goes out to that entire family of that physician and those friends and all the coworkers who were probably completely unsettled today from that event. I try to always remind people that I think that the feeling of being called a hero is very uncomfortable because that implies that we're approaching this with full courage and without fear. But many of us are scared, tired, weak, and facing a lot of grief with these patients who are unfortunately having to be alone in the hospital. As a physician myself, I can attest to the fact that I have worked overnight, increased hours, and I have worked tirelessly to try to fight this pandemic. But I have to also remind myself to take care of myself, to take care of others better. We're trying our best to communicate and check in on one another, but it's definitely a day-by-day process.
Well, Dr. Sutton, we really appreciate your time and thank you for the service that you are providing for the country. Dr. Darian Sutton, thank you so much.
Thank you.
To blunt fears of a possible food shortage, new reporting tonight that President Trump plans to order meat processing plants to stay open. While the meat aisle at your grocery may be stocked now, the closure of several processing plants due to workers coming down with COVID-19 has prompted worry. The president reportedly will force companies to keep running using the Defense Production Act by labeling them as critical infrastructure. This comes on the heels of the head of Tyson Foods warning that the food supply is breaking, leading to food waste and more than doubling the 820 million people globally already facing food insecurity. Well, here with me now is John LeBlanc, Emeritus Professor of Management at Cedarville University. John, it's great to have you. First off, what do you make of the reporting about the president's order to keep plants open and also to supply them with protective gear for employees?
I think it's critical that we do keep them open, but we also have to be very, very careful in protecting our employees, who then have to protect their families and the community. So very much necessary to have the protective gear and to get people back to work.
Spent decades in manufacturing before teaching. What do you see as the long-term effects of a diminished supply chain on farmers, plant workers, on distributors, all the way down to the consumer level? Do you think we'll see a run on meat products like we've seen on disinfectant wipes and toilet paper?
Well, keep in mind that the supply chain has three things: manufacturing facilities, the workers, and the communities. All of them suffer if a facility is down. So therefore, we've got to get the facilities back up. You've got all the different tools and spare parts for manufacturing. You've got the packaging supplies. You've got the workers, their salaries, benefits, daycare, and children's meals that are provided. You've got transportation going into the facility, coming out of the facility, the farmers' feeds, the hog supplies are affected by less use of pork in the supply chain. Now, with supposedly around 25% of the process down, we really haven't been using a lot of the processes. Hog farmers, chicken farmers, cattle farmers haven't been able to get their products to the processing plants because they're over used. They don't have the capability of running anymore because the supply chain is backed up. I think in a couple of weeks, we'll be in good shape as far as the supply chain goes all the way up and down the line. And I don't believe there's going to be a shortage unless people make a run like they did on the toilet paper, which was unnecessary.
I want to ask you, you talked about how interconnected this all is. We haven't seen demand dip even as millions of Americans stay at home. Meanwhile, though, capacity to produce has diminished somewhat. How close are we to a catastrophe? Let's say if there's a massive recall or the food supply gets contaminated.
Well, there's a lot of what ifs that could happen, but I don't believe that will happen. I think all the processors and the farmers are taking the necessary steps to be very cautious, very protective of their products, and in whether it's to market, packaging, or wherever it may be, so that we can keep the supply chain going. Remember, all of that affects everybody's revenue, the farmers, the processors, the cities, everybody, the workers. So I think it'll be protected.
All right, we're going to have to leave it there. John LeBlanc from Cedarville University, thank you for making time to be with us today.
You're welcome. Thank you, John.
Well, a mild winter brought an early strawberry season in Virginia. The only problem with COVID-19, who's going to pick them? As Wendy Griffith reports, those concerns have forced some farmers to cancel their popular picking season for guests, while others open their fields with some new restrictions.
It was picture-perfect weather for strawberry picking in Pungo, a rural area near Virginia Beach. Bruce Henley, owner of Flip Flop Farm, just hoped folks would take advantage with new safety rules in place due to the coronavirus.
The rows in the field are 5 foot apart. So we're putting a flag down every other middle and telling people to stay down the rows without the flags, and that puts them 10 foot apart in the field.
And when people weigh and pay, Henley says they can rest assured.
We're extra sanitizing, we're wiping down all the buckets, we're wiping off the scale in between each customer, wearing latex gloves, doing all we can.
Here on Virginia Beach, strawberry picking is an annual tradition for many families. These are known as Sweet Charlies because just like the name, they're super sweet. And despite the coronavirus, people are out enjoying this beautiful weather while still maintaining social distancing.
We live close by and we're always really excited for strawberry season and just to be out in the open. Everyone seems to be social distancing well, but to get out here with our kids too.
Just down the road, however, Mike Culliford kept his strawberry fields closed to picking.
We're completely opposite of anything we've ever done before. With everything going on, and with the CDC guidelines and what the governor has mandated, our family decided that our first priority was keeping us and the people that help us, our employees, safe. Second priority was keeping our customers safe.
So Culliford decided to take a different route, online ordering and pickup service.
That's the preferred way. You go through our website, prepay. We give you a time slot like the grocery stores are doing, or when you can come pick up your box or bag or what have you.
The decision did not come easy.
We feel bad that we're depriving people of the opportunity to come and pick, and it's costing us money because most people want to do that, so we know we're losing business, but you have to do what you're comfortable with, and this is all we're comfortable with right now.
Another problem for both farmers is manual labor. The pandemic kept many seasonal workers home, so Culliford hired a local girls' high school basketball team to help pick the delicious berries.
And he said that we can come out here and pick strawberries while social distancing and getting paid. So I was like, yeah, count me in, because I work at a restaurant as well, and I can't work right now.
Meanwhile, back at Flip Flop Farm, Michelle and her daughter Neely picked enough strawberries to go around.
Today we wanted to get out of the house because we've been cooped up for so long with this social distancing, and we wanted to pick some strawberries so we can send some joy to some of our friends.
What are you personally going to do with your strawberries?
We are going to cut these up and make our homemade whipping cream and make shortcake.
And that is a sweet ending to this story. Wendy Griffith, CBN News, Virginia Beach.
Is it good?
And now how many of us are craving strawberries? Thanks, Wendy. Well, turning to campaign 2020, Hillary Clinton is the latest Democratic heavy hitter to endorse Joe Biden for president. The former Secretary of State and 2016 presidential nominee joined Vice President Biden in a women's online town hall this afternoon. Clinton's endorsement comes as new testimony is surfacing, supporting an accusation of sexual assault from a former aide when Biden was in the Senate. The campaign has strongly denied those allegations. Religious freedom around the world. We'll break down a new report that lists some of the worst offenders of freedom when we come back.
Hey, if you're tired and exhausted all day, you can't think clearly, and you really just need a cup or even a pot of coffee to get through your day, then join me, Dr. Josh Axe, for this new series where I'm going to teach you how to transform your diet and use essential oils and supplements to get a better night's sleep.
Wake up to your best life. Call 1-800-700-7000 to get your free DVD or booklet of Protect Your Sleep today.
It's about the competition.
I kind of put that pressure on myself, and I think people had expectations.
It's about overcoming.
We use this phrase all the time, keep chopping, keep practicing hard.
It's about going the distance.
I think as a father, it's my job, to lead. Just be the best husband and father I can be.
Watch Going the Distance with Sean Brown Saturday night at 7:30 on the CBN News Channel.
Orphans Promise is committed to loving and serving at-risk children, to helping keep families together, and to creating opportunities for strong and sustainable communities around the world. We're working in over 60 countries around the world, and with your help, we can do even more. There's an old African proverb I love that says, if you want to run fast, run alone. But if you want to run far, run together. At Orphans Promise, we want to run far so we can touch the lives of as many orphaned and vulnerable children as possible. But we don't want to go alone. We're out to change the world, one child, one family, one community at a time. Will you join us?
Welcome back. The U.S. Commission on International Religious Freedom keeps an eye on countries that persecute citizens for practicing their faith. In its annual report released today, the Commission is recommending that the State Department designate 14 countries as top offenders. Jennifer Wishon takes a closer look at how Christians are faring across the globe.
For more details on the status of religious liberty around the world, I'm joined by Tony Perkins, who serves as the chairman of the commission known as USERV for short. Tony, USERV, of course, advocates for religious freedom for all peoples of faith around the globe. It's a very important part of American diplomacy. It's an important part of promoting democracy around the world. But give us a sense for Christians specifically. Where are some of the more dangerous places for Christians who are trying to practice their faith around the world?
Well, Jennifer, that's a good question. There's a lot of dangerous places. There are a lot of dangerous places when it comes to being a Christian. Of course, I'll just say this from the outset. We look at religious persecution across the board. We believe, and this really comes, by the way, from a Christian ethic, the Western Christian worldview, that every person is endowed with the right from their Creator to choose whether or not to follow him. I mean, we see that recorded in the book of Genesis. And so as Christians, we've advocated for every person's right to believe or not to believe. Now, we obviously hope that they will choose to believe and follow God, but we fight for that right and that freedom for all people. But when we look at Christians, they're being persecuted literally around the globe. I would think, North Korea is a place where there is intense persecution of Christians. Of course, it's very difficult to get information out of North Korea, very secluded society in which they're regarded about information, very closed. In fact, even now trying to figure out what's happening there with their leadership. China, we hear a lot about the Uyghur Muslims and what's happened there with the concentration type camps that those Uyghurs are held in, the forced labor. We hear about the Falun Gong and the organ harvesting. I mean, this is just unbelievable. But Christians are also persecuted in China. China, that's one area they don't discriminate in, is in their persecution of people of faith. We see other countries, Saudi Arabia they don't have a Christian population. They don't allow Christians to openly practice there.
And you mentioned North Korea. There are 50,000 Christians languishing in prison camps there. I wonder, are ministries prepared for what may happen if this regime falls?
Well, we certainly pray that the doors open to North Korea, and I think yes. The answer is yes. I think we saw back in when the wall came down in the early 90s, when in Eastern Europe and Christians and other people of faith moved into those regions to meet needs and to share the faith. And so I think there's going to be opportunities if that comes about in North Korea.
During your tenure on the commission, I wonder, do you see the world as a whole becoming more or less tolerant of religion?
I'm encouraged by the fact that Christians in the United States of America are becoming more aware of the persecution of other believers and other people of faith, and are taking steps to address it. Now, that's being facilitated by an administration that has made religious freedom their #1 foreign policy objective, which is huge, tremendous. And so as that awareness grows, there may be this sense that, wow, this problem is growing. It's acute, it's significant, but I wouldn't necessarily say it's growing. Our awareness is growing.
Tony Perkins, thank you so much.
You're welcome. Thank you for being interested in the issue.
Starting to feel restless sitting at home? Well, you're not alone. A look at the isolation fatigue facing Americans after this.
Daddy?
Yeah, buddy?
How many nickels are in $1?
There are 20 nickels in $1.
How do birds fly? Does milk really make my bones stronger?
Yeah.
Daddy, when we die, will we go to heaven?
Do you have the answer to life's biggest question? Call the 700 Club. We'll help you find answers to the important questions life brings your way.
Watch breaking news, in-depth exclusive stories and programs from health to entertainment you won't find anywhere else. The CBN News Channel, a perspective you can trust. Enjoy credible news reporting from around the world. Discover inspiring programs and stories of hope, all in one place from a Christian perspective. The CBN News Channel, a perspective you can trust. To watch the CBN News Channel, download the app or visit cbnnewschannel.com.
Hello, I'm Dr. David Perlmutter, board-certified neurologist and #1 New York Times bestselling author. Wouldn't it be great to boost your energy, eliminate brain fog, and even reverse brain disease? Well, you can, and I'm going to show you how, along with some of the world's most well-respected brain experts in this DVD, Protect Your Brain.
Get Protect Your Brain, a free DVD only from the Christian Broadcasting Network, featuring experts on the cutting edge of neuroscience and brain health.
No matter how many times you've failed in the past, you really can do this.
In Protect Your Brain, you'll discover simple strategies to keep your brain young and healthy. Improve your memory. Discover the gut-brain connection. In Protect Your Brain. Get your free copy at cbn.com or call 1-800-700-7000.
If you want to improve the quality of your life, Get the DVD, Protect Your Brain, and get it today.
Well, understandably, many Americans are itching to get out of the house. Researchers at the University of Maryland track cell phone data, finding more people have been venturing outside their homes in recent weeks. That was evident in California this weekend as people flocked to beaches across the state despite a stay-at-home order from the governor. In Santa Barbara, the beach crowds prompted some people to voice their concern.
There are a lot of people on the beach. They don't look like they're quite distancing like they should be just because everybody has to walk by each other.
It definitely looks pretty crowded, and that's why I'm up here and trying to not go down there, because it doesn't look like there's a lot of room to distance yourself.
Many California beaches are open for individual exercise, but some local authorities are warning if groups continue to gather, they will consider restricting access. Meanwhile, a number of states have stay-at-home orders set to expire this week. Measures in Alabama, Arizona, Florida, Idaho, Maine, Nevada, and Texas all wrap up come Thursday. Not all governors, though, have indicated what will happen afterwards. But Texas Governor Greg Abbott says he will allow his state's order to lapse and that retail stores, restaurants, movie theaters, and malls can open with limited capacity starting May 1st. With the guests away, the flamingos will play. We go to the Denver Zoo for that story when we come back.
I am Region's first ROTC graduate student.
Meet the pastors who are preaching the gospel in a fresh, fearless way. I'm Roberto Torres-Cedillo. Join me each week for Next Gen Voices. And watch God transform a generation.
How'd you like to get a redo on your health, on your body, on your arteries, so you could have the energy you had 20 years ago? The great news is you can. I'm Dr. Mike Roizen, chair of the Wellness Institute at the Cleveland Clinic. I've written 4 New York Times bestsellers. But even better than having to read all that, you can listen to this DVD and watch it. Protect your heart? Yes, you can. Here's how.
Go to CBN.com or call 1-800-700-7000 for your free copy of Protect Your Heart. Let the medical experts show you their new discoveries on how to avoid heart disease and even reverse it. Easy steps to uncover the hidden dangers in your medicine cabinet, reduce stress, and get a complete do-over for your health. Call 1-800-700-7000. That's 1-800-700-7000. Or go to CBN.com to claim your free copy of Protect Your Heart.
Finally tonight, an empty zoo paved the way for a day of exploration in Denver. The park's currently closed to visitors, but one very fortunate group of flamingos got a VIP tour of the place they call home. Animal keepers say they regularly take smaller chicks for walks during the day, and now because the pandemic forced the zoo to close, a group of 77 adult flamingos got the chance to take in the sights. Zookeepers say one of the attractions along the tour that was a big hit along the stop was the visit to the penguins and the Bird World exhibit. Well, how about that? Thank you so much for watching Faith Nation. Have a great night and hope you join us again tomorrow.